Good morning, and thank you for joining us at Washington, D.C.'s inaugural Maternal and Infant Health Summit. By coming together to share our experiences, discuss best practices, and have honest conversations about the health disparities women face, we can build safer, stronger, and healthier communities. Together, we can ensure mothers and babies in communities across the nation have the support and resources they need to thrive before, during, and after childbirth.
I believe that healthy babies start with healthy mothers in healthy communities. It's not just about the women, it's not just about education, it's about the whole community coming together. It's about providing access, it's about placing providers who are well-trained in the communities, and it's about working together.
I think we have an extraordinary community that's really ready to be mobilized, and we have a lot of pieces in place that are already doing a lot of good. When we bring public and private sector folks together, then we're able to both innovate and implement and sustain these kinds of innovative programs.
You need to meet women where they reside. You need to find them where they live, they breathe, they walk, they work. When you take a mom in the first trimester, you get them engaged in the process. You give them ownership of that process.
And if more people are talking about this, there's no reason not to be optimistic. What makes me more optimistic is that we're actually moving in the right direction.
Motherhood was probably the most amazing experience I've ever had. I think it's critical that women, especially women in my generation, get educated on maternal health in general. This summit will be a great opportunity for us to get together with other health professionals, get together with other like-minded people to discuss this super important issue.
The summit that the mayor's pulling together, it's really great for the dads in our community, it's great for the mothers in our community, it's great for our community as a whole.
Having Mayor Bowser putting her hands on the problem and identifying the right individuals to strategically make an impact on these women's lives is huge. It's critical. It is a recognition that people who long felt invisible are now being seen. As a person who's delivered thousands of babies, you can't help but being optimistic, because every time a child is born, you know that this kid has all the capacity to do wonderful things.
Ladies and gentlemen, please welcome the Mayor of Washington, D.C., Muriel Bowser.
Good morning, everybody. Good morning, good morning, good morning. And I want to thank you. Thank you. I want to thank you all for being with us this morning. The Walter E. Washington Convention Center here in the best city in the world, Washington, D.C. Before we get started with our very important topic, I know you join me in wishing our fellow Americans in the Carolinas our best wishes. I know that many of us in Washington, D.C. have friends and family and cousins in Carolina, and that our hearts go out to them, and we want them to get to safe ground and do it today. We're here today to talk about what you saw in the video. Beautiful, healthy moms and babies. In this past year, we've seen a lot of news about infant and maternal health. From NPR to The Atlantic to the New York Times and the Washington Post, our national attention is being drawn to alarming trends in maternal and infant mortality rates. Collectively, more people are recognizing these trends and pointing out that in 2018, in the United States of America, we can and should be doing better for our women, our babies, and our families. We're sounding the alarm that these rates are even higher for women of color, particularly African American women. And we're looking at places like Washington, D.C., right here in our home, where the rates are higher than average, and taking a critical look at what we're doing right, what we're doing wrong, or what we're not doing at all. We're recognizing that maternal mortality rates are not only the data we must pay attention to, but that we must dig deep into the numbers of women who suffer life-threatening complications also as a result of childbirth. One childbirth-related death, we can all agree, is one too many. And we know that the reality is that for every woman who dies in childbirth, 70 more women come close to dying. We convene summits like this one because we know, because experts have confirmed, that many of the deaths and complications that result from childbirth are preventable. So we're here, and there are many of us here. I think we set up for 800, and there are people standing. So we're adding chairs, and they'll be added to this side, and you'll be able to find a chair in a moment. We're here to have an honest conversation about successes and challenges, to hear from experts about what we know. We're here to understand how the information that we have available can be best used to improve outcomes for our women. Now, we all know that these are complex issues. We know that a mother's health history does not reset the moment she becomes pregnant, which means that we cannot only focus on women when they become pregnant, but we focus on well women throughout their lives. It means that part of this work is keeping our focus on building healthier communities, communities where families have access to housing, fresh food. How about that? Fresh food, and opportunities they need to live stable and healthy lives. For some communities, that means making sure that women and families have the insurance coverage that they need and deserve, so that no one living in the United States of America is scared to go to the doctor because they're worried they won't be able to afford it. For others, like here in Washington, D.C., where fully 97% of Washingtonians are covered by insurance, it means getting more people connected to the right care at the right time. So we will be reminded throughout the day why access to high-quality, affordable health care is worth fighting for. We will be reminded that the debate, a debate that is still taking place at the highest levels of government about reproductive health care, should not be about whether we can have access to it, but rather how we can make it better. We will hear from my fellow mayors, and I want to thank the African American Mayors Association, the National League of Cities, and all of our healthcare partners who Dr. Nesbitt will introduce for their partnership with us in Washington, D.C. on this very important topic. We'll also hear from our local on-the-ground experts like Brenda Rhodes Miller, who is the founding executive director of the D.C. Campaign to Prevent Teen Pregnancy. Brenda was tasked with cutting the district's pregnancy rate in half for teen mothers. She accomplished this not only once, but twice. She's been on the front line since 1999, and I'm grateful she is with us today to share her experiences. My hope that is whether you're a new mom, a healthcare professional, a mayor, a social worker, a provider, that no matter what brings you here today, that you leave with new ideas and that you leave with the resolve to come back and help us to make outcomes for women and babies better. Throughout the day, you must remember that the challenges we face are neither inevitable or intractable. I frequently say that many of our problems can be solved with political will and consistent investment. And I know today we're going to learn a lot more. I look forward to hearing from the panelists. I look forward to being a part of the mayor's panel and later a panel with the former senior advisor to President Obama, Valerie Jarrett, and Cathy Hughes. Thank you very much.
Ladies and gentlemen, the District of Columbia Director of Health, Dr. Laquanda Desmond.
Good morning. Thank you, Mayor Bowser, and welcome to all of you to the inaugural Maternal and Infant Health Summit. I want to thank everyone for being here today to discuss an important issue that is critical to the success of our city and to our nation. In particular, I'd like to acknowledge Mayor Muriel Bowser and the other co-hosts of today's summit. Mayor Karen Freeman-Wilson of Gary, Indiana. Mayor Lovely Warren of Rochester, New York. And the mayor of my hometown, Flint, Michigan, Karen Weaver. I also like to acknowledge the African American Mayors Association and other elected officials joining us here today from DC and across the nation, our community partners, healthcare experts, and health officials, and finally, our district residents, particularly our moms and their families. The purpose of this summit is to elevate the issue of perinatal health, which is defined as the health and well-being of mothers and babies before, during, and after childbirth. For the past 3 years here in the District of Columbia, we have worked to implement a perinatal health framework that is illustrated by the graphic you see here behind me on the stage. You will also notice that it is plastered on your water bottles, on your notebook, around the Health Expo, and you'll notice that the individual graphics have been placed on kiosks to give you more information about it. I encourage you to take time to familiarize yourself with this particular framework. The framework is based on the goal of ensuring that every community understands its health risk and its role in improving perinatal health. So no matter who you are or where you are in life, you have a seat at this table. The framework has 4 strategic areas. The first is improving preconception health. We know that healthy women tend to have healthy pregnancies and healthy babies, which is why we focus on the health of our girls and women. Next is assuring high-quality health care. We want to make sure that all healthcare providers utilize the tools and resources necessary to ensure that our women and babies have the best chances for success. We also want to assist district families with preparing and caring for children. This means that every parent has the skills and resources they need to provide for their families. And finally, we focus on promoting safe and healthy environments so that every infant, mom, and dad has a safe and healthy environment in which to thrive. Throughout the day today, in addition to hearing from mayors from across the country, you will hear from national and local experts who have expertise in the various areas that are the foundation of the district's framework. They will share stories from the field and their vision for what it will take to improve the health and well-being of women and children in our nation. We hope these panels will help you better understand our framework and how it can be further applied in the district and elsewhere. We firmly believe that this framework can be a model for the nation, even if its application looks different in other settings. In today's panels, we will focus specifically on the areas of clinical quality and community-driven approaches to improving perinatal health. We will start with a discussion of the current trends in maternal and infant health, including maternal mortality, infant mortality, birth outcomes, and health disparities. From there, we will hear about best practices, including evidence-based initiatives, covering healthcare and community-based initiatives that address social determinants of health and health disparities. And lastly, we will discuss recommendations for healthcare and public policy that will improve maternal and infant health here and across the nation. We have an exciting agenda planned for you, so on behalf of Mayor Bowser, I want to thank you again for coming.
Please welcome to the stage the moderator for the mayoral panel, sharing best practices and lessons learned, Maria Harris Tilden, Senior Vice President for Public Policy and Community Affairs for Care First Blue Cross Blue Shield. Our panelists consist of Mayor Muriel Bowser from Washington, D.C., Mayor Karen Freeman-Wilson of Gary, Indiana, Mayor Lovely Warren, Rochester, New York, Mayor Karen Weaver, Flint, Michigan, and Mayor Tony Harp, New Haven, Connecticut.
I am so delighted to have the opportunity to be here today on behalf of Care First, and frankly on behalf of an issue that I personally and our company has been incredibly committed to over the years. It's been my pleasure to have an opportunity to learn about the wonderful things that each of these mayors is doing in their cities, and I'm really excited for the chance to hear more. I first have to thank Mayor Bowser for having the vision and commitment to pull together this forum, which is highlighting an issue that each and every city across this country should be focused on with a laser focus.
Maria, could I jump in for a second?
Sure.
Because I want to thank you and Care First for your commitment to Washington, D.C. and the health and wellness of Washingtonians. Please give Care First a hand. I also want to acknowledge a number of our healthcare partners that have been a part of pulling this inaugural effort together. And you notice we call it an inaugural effort because we think that this is an issue, like I said, that takes political will and persistent investment. So let's also acknowledge Sibley Memorial Hospital, MedStar Health, AmeriHealth Caritas, the Amera Group, Children's National Medical, the George Washington University Hospital, DC Primary Care Association, the National League of Cities, and the African American Mayors Association. Thank you.
Thank you. Thank you, Mayor Bowser. And again, what a delight and pleasure it is to participate in an event that is focused on something that is so important to each and every one of us. Look around the room. The fact that there are 1,500 people plus that have signed up for this event means that we have hit a nerve, and that this is an issue that people are hungry for an opportunity to exchange ideas and best practices. And I think we have the perfect panel of mayors who are at the center of coordinating efforts to address this issue. So I'd like to just jump right in, Mayor Bowser, and we were all delighted last week to have an opportunity. For those of you who have missed it, you got to go back and check out the Today Show, where we had a chance to be introduced.
Thank you.
To Mayor Bowser's new baby girl. But I'm curious to know what drove you at this moment in time to put together this discussion.
Well, probably like many people in this room, I read Serena Williams' account of her experience. And when I read that, certainly I have been briefed and informed by our medical professionals in DC, and we're following our trends closely. But what really hit the nerve is here you have frequently people associate poor health outcomes with less income. And what we saw with the Serena Williams story is that no matter your income, your age, we had a well-informed woman who was having a very negative medical experience that caused in a very difficult situation for her. And that made me think, if she's having that experience, what's happening to people who have access to less information or don't have access to quality health care? They're really having that experience. And quite frankly, we're taking a hard, close look at what we're doing in this city because we need and must improve outcomes for women and babies. But the reason why I wanted to invite my fellow mayors is because we're not unique. Our women across this nation are experiencing the same issues, and I want to learn from them, and we want to pull our forces together, because some things we can do locally and some things we need to demand national action on.
Thank you so much. So, I want to turn this to Mayor Weaver, who we know has particular challenges over the past few years. I mean, we think of maternal and child health. Sometimes folks view it as a clinical issue, but there's a real appreciation, I know, by everyone in this room that there are social determinants of health, which include all kinds of experiences in your environment. So tell us about what you've brought to bear.
Okay, thank you. Thank you. And first, let me just thank the sponsors for pulling this together, and Mayor Bowser, because this is such an important issue. And it's interesting because there are so many things, you know, as you ask that question, that we don't even think about that impact maternal health care and the outcomes for young infants and young children. And we found that firsthand in the city of Flint. We already had issues that were going on that many other urban communities face. But then when you put a water crisis on top of that, it made us look at some other things. And infrastructure and water quality are two of the top things. Those are two of the very top things, and we found out the hard way. So one of the things I am hoping that people are doing is paying attention to what's going on in Flint, because it's going to impact so many other cities across this country when we're talking about health care and maternal health care. And it's interesting to me, we had to put some things in place. We had to put some things in place as a result of a crisis that really should be in place regardless of if there is a crisis happening in your city. But one of them is looking at the lead and copper rule. Looking at the lead and copper rule right now at 15 parts per billion, that makes no sense. And while Michigan is leading now in lowering that, it only went to 12. We've been fighting to make it lower because we know no lead is good lead. When you look at the lack of investment that's going on in infrastructure, that's a huge problem. It's a huge problem. And right now, because we are changing those lead service lines, even looking at the technique by which it's being done is something people need to look at. One of the things that got us in this situation was people trying to save money and cut cost. And so now, as we look to replace those lead service lines, they wanted to do another procedure where we found out we were missing some of the lead and galvanized lines. And so we said that hydro excavation was not the way to go because you miss things, and it's better to do traditional kinds of digging when you're replacing lead service lines. One of the good things that happened in the city of Flint, and it's something that I think everybody should do, is we got a lead registry. We have a lead registry, so everybody that has been impacted by this water is gone into a registry, and then you can connect them to other services, and you can see what they didn't get and have someone follow up and say, you qualify for this. But why should you have to have a water crisis to have comprehensive medical services? That's something that doesn't make sense. It doesn't make sense. Right. One of the other things we did was we put in place a chief public health advisor for the city. Because while you have that at the county level, you still need someone advocating at the city level on behalf of the residents of your city. And I hope that's something that's going to stay in place throughout this. That's really, really important. And the other thing is we got the Medicaid expansion. We got Medicaid expanded up to age 21 and for all pregnant women. But that's something that should not have had to come as a result of a crisis. Those are things that we should have without a crisis. Why do we have to wait for these kinds of issues before we want to give good health care and access to health care to women? It just doesn't make sense. So those are some of the things that we've been looking at, and think that not only should they stay in place in Flint, but they should go countrywide.
Excellent. Well, one of the things I think actually this room represents is the importance of a collaboration and a comprehensive strategy with all stakeholders, communicating and having conversations about what best practices are, but actually coordinating. And I know in Rochester, Mayor Warren, you guys have done an excellent job with your Healthy Babies Network of coordinating all of the pieces that are important for that life course, pre and postnatal, for successful outcomes. And so tell us a little bit about that.
Well, in Rochester, we have about 28 different agencies, both our universities, our hospitals, our not-for-profit agencies, government, all working together to make sure that not only our mothers, but our children and their families have the resources and access to resources that they need in order to improve outcomes. A number of years ago, we had another crisis around lead where it was lead poisoning in children due to paint. And we had to really take a step back and look at what we were doing in rental housing, where we testing and making sure that kids and families knew that there was lead paint in their homes, and we had to change all that. One of the things that we started to do with the nurse-family partnership is that every parent gets a nurse that goes home with them, especially in those challenged neighborhoods, from birth to age 2. And they go home with them, they meet with them, they make sure that they're there with them. So we wanted to make sure that mothers had access to resources that those individuals that have money have access to. Another thing that we looked at was really holding landlords accountable. And the city instituted an ordinance that inspected homes. We went in and we held them accountable. We made sure that they made those repairs, and our numbers have dropped. We instituted a really robust reduction in teen pregnancy program. Since 2008, we've been able to reduce teenage pregnancy in the city of Rochester by 60%. And that is because of this network that we have. And so we recognize that no one entity can do it alone. You have to have the university at the table, you have to have the hospital at the table, you have to have the community at the table. And I want to thank Mayor Bowser for bringing this issue to the forefront, because everybody plays a part in it and making sure that all families in the community thrive. And I think that this is what, bringing this to a national level is what we needed to do.
Thank you so much. And so going to the Hoosier State, Mayor Freeman-Wilson from Gary, tell us a little bit about the efforts that you have underway in Gary, Indiana. There's been, I think there's a real appreciation for case management and care coordination, and curious to know how you've implemented those strategies in Gary.
Absolutely. First and foremost, I do want to thank Mayor Bowser for her vision and for allowing me and our other mayors to be a part of it, and certainly want to thank the sponsors. What we've done in Gary is really look at who the primary players are, and so many are here today from DC. We look at our Healthy Start Network. We look at our federally qualified health centers. We have 2. Merrim and Community Health Net. Actually, we have 3 that serve Gary residents, because we also have North Shore, which operates on the outskirts. We also have our own health department. And one of the things that we do is first make it a priority. Because if you make it a priority, then we can use our convening power to bring the parties together and say, how are we serving families? Where are those gaps? How does our use of community development block grant money also allow us to do lead assessments to make sure that our children are safe and to make sure that we provide the right environment. But we also are in a position to say to moms long before they get pregnant, how do you ensure that you are at your healthiest when you become pregnant? How do you plan pregnancies? How do you think about the duty that and responsibility that we have to our children? You know, everybody thinks about it once they're here, right? Because, you know, they're here and they're in front of you. But what about that duty to get involved in prenatal health long before the child is born, your child is born? And the other thing is that we involve dads. Because, you know, so often, because the mom carries the baby and the mom is the, you know, person that we focus on, we forget about dads, particularly during prenatal care, as the person who can encourage mom to get that care that she needs to make sure the baby is healthy. And then we also use positive peer pressure, support groups for moms, support groups for dads, support groups for families, so that they understand that when you are making those appointments, keeping those appointments, making them a priority, even in the course of busy days, because we all have them. And, you know, it's so easy to say, well, I'll go to the doctor tomorrow, or I'll reschedule that appointment. When we make those appointments priorities, then we are, in fact, ensuring that we have healthy children.
Can I say, I wanted to say something about what you just said. When you were talking about making it a priority, and I think that's one of the things we found having a chief public health advisor that works for the city, because now you're making decisions with health and all policies. So she shows up, we're talking about lead service lines, and she's there making sure that you know, health is the priority. When you look at cities having to address water bills and do you shut this person's water off, those kinds of things, it's like, wait a minute, what are the health implications when you have this amount of water shut off and you're talking about water needing to move through a system for it to be able, you know, for people to be able to drink it. And so she really has us looking at different areas where we would not have thought about what are the health implications. And so we have an opportunity to do that as well. And I think that's really, really important, as health fits into all of the decisions that we're making now. So I'm really proud about that.
So one of the things that I think everyone understands very acutely in this room, that even with the best of intentions and motivation, you can't get this done without the funding. And everyone appreciates that, that dollars for these initiatives is under assault now at the federal level. You mentioned some very creative ways of looking at housing block grants to support your work. I'm curious as to whether what strategies you are putting in place to ensure that the people in this room and back home have the funding that they need to get the job done from a policy perspective.
Let me just add that we took the step locally to make sure that the Affordable Care Act was protected in Washington, D.C. By requiring our local individual mandates, so we can continue to make sure that over 90% of our people have insurance. So that is one thing from a policy perspective that has been very important. I will also say, because given that, one of my big frustrations is most people have insurance. Why aren't most people going to the doctor? And our conversations with our providers and HMOs and insurers in DC is how we can be a part of the conversation to make people feel confident about going in and talking to their providers. Why are people avoiding the doctor in their first 3 months of pregnancy? And I think those are kind of critical questions for us to ask about healthcare literacy in our communities. So that's part of the investment we're making. So we want to make sure we have the right amount of funds. but how can we make sure that the investments that we're making are actually being used to improve health outcomes in our city? And I think a big missing link that we haven't quite figured out is how we can have mom and to-be mom going to have honest conversations with their healthcare providers and not being scared and being confident and asking questions and pushing to say, hey, doc, something's not right here, and I need you to listen to me and make those responses. So we're really focused on how we're better leveraging the public health dollars that we're already investing so that people are connected to a medical home and they're getting all the services that their insurance already provides, and putting themselves in the best health possible before they become pregnant.
And I would just like to add to that. One of the things that we do is we work together. What's happening in Rochester is happening in DC, it's happening in Flint, it's happening in Gary, Indiana. And so through the African American Mayors Association, we're passing resolutions. We're working together to advocate for funding on a federal level, on a state level, on a local level, to support these types of efforts. Because we can't, we can't do it alone. We need that support in the community through our foundations, through our sponsors, as well as through the federal and state governments to support the efforts to change lives for the children on the ground. No one can be left behind. And so by working together and making sure that we provide those networks and those linkages, we are able to really advocate on a national level, whereas it's not just the individual Rochester going for this. We're all doing this together and trying to protect Title V funding for these types of programs.
And I'm going to have to say, that has made a huge difference. It really, really has, because they know when we're coming together, we're coming as a force. And I know I have sent some information to AAMA saying, hey, this is what they're trying to do to us in Flint. They're trying to have us cut costs and do things in a way where we're still going to mislead and galvanize pipes. And they have spoken out for us. And when they see that, when the state sees those kinds of things, it's made a huge impact. And and not just on the state level, but on the federal level. And so being that strong, united voice has really, really made a huge difference for us. And it's having that political will to do that.
You're absolutely right. I think the other thing that you're hearing, and it's a common theme, is the development of systems of support. And that's where organizations like the African American Mayors Association, that's where the National League of Cities comes in. Money is always good. I don't think you'll find a mayor here or anywhere else that will turn down money, but technical assistance is priceless. There's a collaboration between the National League of Cities and the Pritzker Children's Initiative to provide technical assistance to cities to build systems. How do you build systems using what you already have, using the programs that are already in place? Mayor Bowser talked about the use of the Affordable Care Act. We actually sign people up in City Hall. So every time there's an open enrollment period, we're like, hey, you all, not only are we doing it in hospitals and in our health departments and traditional places, but we want you to come to City Hall so that when you come for your other business, you can also sign up for the Affordable Care Act during that open enrollment time. So if we build systems around people, then it's hard for them not to do what we know that they need to do.
And another thing that we are trying to explore more is how we can get our technology community involved in this question, because sometimes we have silos in government that this is a health issue. But can't technology help with our health issues? If people can use swipe to the right to find dates with their phones, they can't figure out how to get access or better access to our services. Our policies and procedures should help our health professionals be able to communicate with patients with telemedicine over the phone. I'm a big fan of not even having to go to the doctor, but to send the doctor to a secure message to say, hey, what do you think about this, doc? And we have to normalize those things. But I think our technology community that's coming up with all kinds of advances in transportation and other things, how can we use the little computer that we all walk around with to be better connected with our physicians and to better plan for childbirth?
So I'm going to turn it back to Rochester, as I know that, that you have done a lot by way of coordinating all of the different services and agencies through your Healthy Babies Network. Are there any lessons learned as you created that process along the way, challenges and opportunities that, that could be helpful as folks in the room are pulling those efforts together?
So as it pertains to, bringing everyone together, it was a really good effort for all of our universities and hospitals and providers and not-for-profit providers and the community to get together to really put this at the forefront of our agenda. One of the challenges that we found was that we're started for the last couple of years screening children 1 to 3 for developmental delays. So we're not going to wait till they get to school to figure out that there's a speech delay or they're hearing impaired or that they need glasses. And what we found was that we don't have enough providers to be able to service. So we're screening all of these children and we don't have enough speech pathologists. We don't have enough speech pathologists to get out there to get in forefront of helping these children along the path so that when they get to kindergarten or pre-K, you have this issue. Another thing that we did was we advocated, it allowed us to advocate for pre-K funding for pre-K 3 and pre-K 4. We realized that being children going to school at age 5 was just too late. We needed to start it earlier. And so we were able to get state funding from our Governor Cuomo and was able to increase pre-K 3 and pre-K 4 enrollment by 1,200% in the city of Rochester. And so those types of collaborations allowed us really to see where we were deficient and to improve it and to make sure that we are trying to connect the dots and build those systems as Mayor Wilson was talking about, because I think that that's very, very important. If you can see the linkage and where you're deficient at, then you can make those improvements and know what you're advocating for when you go to the state or to the federal government to improve those issues.
Yeah, we've mentioned the National League of Cities, the African American Mayors Association. We've got 4 policy leaders on the stage. What are the policy levers that you think you and mayors across the country should be pulling to address this issue in a more comprehensive way?
I think certainly for us, we have a bill before our council now. We call it the Babies Bill, and it is meant to focus across all of our agencies between the executive and the legislature, the things that we need to have in place to encourage the birth of healthy babies. We will begin, if we haven't paneled already, a infant mortality review board so that we are examining every case so we know what happened and what we learned and how, if possible, that death could have been prevented. So we think that's critically important. We also, I guess it's going on 2 years, we started a Thrive by 5 campaign that is technology-based. You can go to a central place, a website, to look at all of the programs and services that are already offered to a family so that they can have access to quality daycare. They can have play groups and recreation time, know what's offered for free at our Department of Parks and Recreation. I know all of the mayors probably would agree with this. We are all wanting new residents and businesses to come to our cities. The quality of life for families is key to how a city grows. And we want DC to be a place not, just for great events and sports. We like that too, but we are really a city of of great neighborhoods, and families are a key part of that. So how do we make sure that every resident, every young family, every prospective resident knows all of the free services that are available to them? But I would have to thank and I'm in a great position, I hope you all are too, in saying when I work with the legislature, we're all kind of in lockstep on doing what we have to do to support healthy babies and families.
Absolutely. You know, I think that the thing that we do best from the standpoint of policy is ensuring that whatever practice is used is evidence-based. You know, a lot of folks have a lot of great ideas, but if you're not measuring the results and quantifying them so that you can determine that this great idea really is good, and that idea, it sounds good, but it really didn't work as well as it sounded. So the utilization of evidence-based practices, and then not just using them on a small number of folk, but to really scale it up. And I think that's what the organizations, not just the governmental organizations, but the health and physician-based, insurance-based organizations can really assist communities in doing, scaling those programs and practices up so that we get the maximum benefit in cities that have a lot of people. The other thing that I would say is we can't underplay the cross-section or intersectionality of mental health in this space. You know, it's been 24 years, but I remember when I had my daughter, and I'm like, oh, this is something really new. And I know how to do a lot of things, but this kid didn't come with a manual. And, you know, yeah, my mom was there and other people were there to help, but at the end of the day, it was just me doing something really new. So when you provide that support and tell new moms that don't have the resources that we have, or many of you in the room have, when we say, you know, it's not just you. This is hard. And it's not hard because it's just a hard thing, but it's hard because it's something you haven't done before. And as mayors, I think we can provide both mental health resources and other resources to make it easier.
I'm glad you brought up mental health because that's one of the things we have been talking about, and while we have been able to get school nurses back in all of our schools, the mental health, I know it's a great thing. The mental health piece has lagged behind, and that's a huge concern for us. It really, really is. And you were talking about, as you're educating new moms or new parents, one of the things we've also had to say is, because it has to be more than just them, who is your support system when you're talking about mental health? Who is it? Is it your neighbor? Is it a friend? Is it a relative? But bring them with you. Bring them with you, because that information needs to be shared with their support system as well. Because when we leave them out, they don't have anyone else to turn to or anyone else to go to that appointment and speak up with them. And people need to not be scared to say, I don't understand what the doctor just told me. But you talked about the school-based health clinics, the federally qualified. And I think that's another thing that we really, really have to speak up and advocate for, because that's where a lot of people feel comfortable going there. A lot of people feel comfortable going to those, and they provide a different level of medical care and information. And so we have to speak up on those FQHCs as well and make sure those are funded and funded at the level that they need to be.
So
So we only have a few more minutes, but you mentioned behavioral health and the importance of ensuring that that is a component of the overall solution and package that's available to moms. Are there any unique approaches to expanding access to behavioral health to new moms who are going through that process and sometimes dealing with challenges?
Well, go ahead.
So I know in Rochester, part of the nurse family partnership, that's what we're trying to do is link the nurses with the family so that they have that support right there with them along the journey. And so when you realize and recognize that there may be challenges up front, you can get them connected to the services in the community that they need. One of the things that is also very, very important is protecting those things that work. And the reason why, I've been a strong advocate for Planned Parenthood and making sure that we're protecting women's rights and other things is because when there are things that work like long-term pregnancy prevention, contraception, we know that that's helped us with our teenage pregnancy, but there are forces out there that want to take that away. Well, we need to speak up and we need to advocate for it. We need to protect it, and that's partly what we're trying to do. So for us, it's really looking at what are those programs that are evidence-based, as the mayor talked about, that are working, and continuing to do those and getting people access to those resources in the community and connected so that they don't feel like they're all alone going through this. I remember when I was pregnant with my daughter, I had toxemia and preeclampsia, and the doctor walked in and they just said, well, we're going to induce the baby is, she's just under stress. And so here I am, in tears, but I had my mom there. I knew that I was in great care. And so making sure that the social workers are in the hospital as well, working with these families that need that support is very, very important. And it's up to all of us to protect those funding and making sure that they're available to our constituents in our community.
Exactly. And we need to, like you said, we've got to protect that funding, but we need to stop acting like mental health is separate from physical health. We need to do that and stop stigmatizing mental health and acting like something's wrong with you if you need those services. I'm a psychologist, and one of the things, I had a life before I became mayor, and that's what I was. And so one of the things, I worked at Mott Children's Health Center, and one of the things we wanted to make sure, and we were working toward, was putting mental health services in the OBGYN's office and in the pediatrician's office where they need to be. And some of the other things that we're working on before I became mayor, and that's why it was important to me to keep some funding going there, was we started putting some services in churches. We started putting those services in churches because people wanted to go there and they felt comfortable going there. And so I'm making sure that some of those community block grant dollars go to support those kinds of services.
One of the things that Mayor Bowser mentioned is the importance of technology, and then when you talk about behavioral health services and the difficulty sometimes members have and people have in accessing those services, technology is becoming the go-to way of bridging that gap. And I'm curious to know whether or not you have experience or pursuing any unique approaches to utilizing technology from a citywide perspective?
It is the kind of the challenge, Maria, that we've thrown out to the tech community to offer us some ideas, as well as our insurance community to offer us some ideas. The way that we can shape that is say, you want to work with us, this is what we need you to do in response to this RFP. We've been able to do that to help drive people out of ambulances and into their doctor's offices, and we want to do the same thing around all of these needs. I think we're all challenged to think that our customers are changing. Okay, millennials do things differently than Xers or baby boomers have done things, and we have to adapt to how they interact with the world. And I think the same is true for healthcare and how we have to give them the information to make the choices that they need. And so I think that technology is going to be hugely important in that. And so that we're looking at, and it was mentioned that in the Healthcare for All policies, Dr. Nesbitt is very focused on making sure when we look at how we procure something that we are requiring people that work with us to think about the health of DC residents and all of those goals. And we have laid out a Healthy DC 2020 that is a framework for us to reach those goals. And I couldn't agree with Karen from Gary, in saying that we also have to challenge ourselves. Some things that we've been doing for years and years, we're not getting the results that we would have expected. And we have to be honest, otherwise we wouldn't be here talking today about why we're not happy with the outcomes. And so we all, the provider community and insurance community, have to say, hey, that didn't work, let's move on and do what works. And sometimes that means that some of our partners have to retool and reshape their programs, and we all have to buckle down and do that.
Well, this has been an incredible dialogue with amazing women, amazing mayors. I want to thank Mayor Bowser, Mayor Warren, Mayor Weaver, and Mayor Freeman-Warren for your insights, the fact that you came and are here today, and wish you Godspeed in your quest to continue to expand and address this important issue.
Well,
so thank you.
You are an excellent moderator, and we want to thank you, and a trooper at that.
Thank you.
I have 3 kids, 2 girls and 1 boy, and currently pregnant. At about 12 years old, my little brother died of SIDS, and I took it hard, and I tried to commit suicide, and I was admitted to the psych ward. At 14, my mother's boyfriend decided to, have sex with me. I became pregnant at 17 with Eternity. I started Healthy Babies. They helped me with parenting classes, and I went repeatedly so I can get the full effects. It was a new-time mom. I didn't know what to do. And I became family members with them. Like, they would feed me, give me housing. They do the Christmas and Thanksgiving, for the families. Kids are hard, and it's real. It's not just a toy. You can't just dress it up and put it back on the shelf like your doll baby. But I feel like these kids made me who I am today, too, so, I'll take it. In 2011, I completed my GED with the help of Healthy Babies. And Miss Ray Jane, the director, was like, you gotta keep going. You gotta keep pushing. So 2012, spring, I enrolled into UDC Community College. And I was mad because I didn't go the whole high school route. I wasn't there intellectually, and I didn't know what I needed to know. So I had to do all the prerequisite classes that didn't count towards my degree. But it helped me learn, what I need to know. And now I know. And you can't tell me nothing because I know it now. And now I'm currently a junior working on my bachelor's. I have 2 more semesters to go, and I'm done. Well, I'm not done because I'm going to law school after this. Yes, I'm going to UDC Law. What else? I'm excited. Because you're making me think about my story, and it's dope. you know, because I could have been somewhere else. And Lord knows, I know I should have been somewhere else, but by the grace of God, I'm still here.
So good morning everyone. First would like to thank our Mayor Muriel Bowser for bringing us all together, and she deserves a round of applause again, as well as Dr. Laquanda Desmond in DC Health. I know that it takes a lot to bring this type of program together. Our distinguished panelists that you'll meet in a moment. Again, my name is Dr. Roger Mitchell Jr. I'm the Chief Medical Examiner for Washington, D.C., but as it relates to this, I am the chair of the Child and Infant Fatality Review Committee for the District of Columbia, as well as the organizing agency for the new Maternal Mortality Review Committee that's set to start this fall. And so we know that these infant and child fatality reviews, as well as our maternal mortality reviews, are important in establishing systems and how these systems can affect the health and well-being of the mothers and infants that we serve in any particular jurisdiction. We're going to level set. What I wanted to talk about is in the District of Columbia from 2012 to 2016, there were 14 maternal deaths. From that same time period, there were 18 pregnancy-related deaths. That's up to a year. And so those are our numbers in the district. As far as infant deaths, 60% of our infant deaths in the District of Columbia are dying within 7 days of life. So it really says more about our prenatal care and the care of our mothers than it does necessarily about our infants. Although we have bed sharing and co-sleeping as an issue here in the district like every other place in the country. I'm going to start with all of you. What are the maternal and infant health misconceptions surrounding the health or wellness or even deaths that are occurring surrounding how our mothers are receiving care or how our infants receiving care? What are some of the myths and misconceptions surrounding that? I'm going to start with Dr. Liu, and then we'll move down.
Sure. I think probably one of the biggest misconception is that this is all about prenatal care. That if we could just offer high-quality prenatal care to every woman, then all of this maternal and infant mortality problem will go away. I think over the last 2 decades, we've learned a lot more about what really the root causes of infant mortality and maternal mortality. I think that it has a lot to do with the health of the mother before she gets pregnant, which has a lot to do with her access to health care across the life course, but also has a lot to do with the social conditions, the poverty, housing, education, father absence, racism. So if we really want to do something about improving maternal and infant mortality in DC and in our nation, we have to improve health care for all women and families, but we also have to improve the social conditions and address the social inequality for which the high infant mortality and maternal mortality are symptomatic of.
So you said it all, I think, Dr. Liu. But I would emphasize, I think that we really need to really focus on citywide on a curriculum that really focuses on implicit biases from our provider's perspective. The biases that we have, the customer services that we provide to people, and in addition, the cultural humility that we all as providers must have, from providers to social workers, all kinds of providers at all levels, including the person who answers the phone to the person who is at the front desk. And it's hard work. I'm not here to say that we do it perfectly, but it's something that we spend a lot of money on to make sure that that's because we have a great insurance. Everybody is insured, as we said. Most people are insured, and we have great centers that people are not entering. And so I think that instead of saying that we put the blame on the client has all these services and they're not compliant with the care, what are we doing as institutions to be compliant with their needs?
Well, I don't want to repeat what Michael and Maria have said, because I agree with all of that. I would just add to it to say that I think there's a misconception that somehow in the U.S. and in big cities like Washington, D.C., we have the best healthcare system in the world, and people are often not understanding why it is that we have the outcomes that we have. But the reality is that even though we spend the most of almost any industrialized country in the world on healthcare, we do have the worst outcomes, especially for moms and babies, and that's across the board. So whether or not you're looking at the rates of prematurity, which have been increasing for the third year in a row, and we'll be talking more about that in November when we have Prematurity Awareness Month. Rates of infant mortality have been going down, but we do have incredible disparities. And then rates of maternal mortality and morbidity. And I think it's important to talk about both, mortality and morbidity. Women that are both dying as a result of childbirth and also becoming so ill that they almost die, what we call near misses. You know, the fact that those rates have been increasing, the rates of maternal mortality in the U.S. have doubled over the past 25 years. So this misconception that somehow the U.S. should be at the top of the list, and we really aren't. We're at the bottom as compared to other industrialized countries, is something that we have to repair, and I think it's a misconception in how our healthcare system really is delivering on results for moms and babies.
So the joy of going last. But I would just like to echo the comment that Maria made about not blaming moms. And I think that sometimes there's sort of a stereotype or well, if they only just knew, or why don't they know? And I think we need to really realize that being pregnant is wonderful and miraculous and really stressful, right? You're sick, you're not feeling good. If you have another child, you're trying to take that other child and pregnant on the bus to get across town to see a provider that you may or may not have to wait for. And how do we really listen to what moms and women have to say about what the barriers are and really concretely address those barriers? And I think we just really need to work on how do we make it all easier for women who are pregnant and for their families, and we need to really listen to what women are saying about that.
So Kelly, we're going to stay with you. You've been doing this work for over 20 years. And you're the CEO of Community of Hope since 2001, and you oversee that major operation. One of the things that I wanted to ask you about, we talked about some of the social determinants. We talk about economics, education, healthcare access, even criminal and environmental justice. But you have a particular take on housing. And so the work that you're doing on housing and how it affects the health and wellness of the mother and the baby. Can you talk a little bit about that?
Sure. And so Community of Hope is a federally qualified health center providing services throughout the city, medical, dental, behavioral health, and a real strong emphasis on prenatal. But we're also one of the largest providers of housing for families who are experiencing homelessness in the district. And I think when you look at housing, we know that housing instability is really a factor. If you're couch surfing, if you're sleeping at a shelter, if you're at one of the motels, that again is another significant barrier to accessing care and being healthy. The district has done an amazing job, and a shout out to the mayor and the many partners who are really working to reduce family homelessness in the district by investing significantly in homelessness prevention programs to try to prevent families from entering into shelter, by investing in permanent housing solutions, and really trying to stabilize families as much as possible. But I think there's both homelessness prevention and then there's sort of plain old affordable housing. So how do we keep families out of shelter, but how do we really need to continue to invest in housing that's affordable for all levels, that's safe. When we were talking about lead and other environmental factors, but also just physically safe. And the number of women who talk about feeling safe and how important that is something that we need to continue to invest in and pay attention to.
So yeah, that's good. And as part of the infant mortality group, we focus in on housing and insecurity. We identify that homelessness is a huge risk factor, particularly in when a woman is going to sleep with her child and not sleep with her child. And so that safety of having the security of your own home allows for that woman to more likely place that baby in the bassinet versus the homelessness in a motel or some type of shelter where you really want that baby next to you, sleeping with you. And we found that in several of our cases. Maria, you're the founder of Mary Center. Yeah, that deserves some major kudos. It's a community health organization, and you've grown the initial budget of $250,000 and 200 participants to $59 million, and now serving over 50,000 individuals in the district and in Maryland. Tell us a little bit about your growth over time, how you're serving these mothers, how you've seen the work grow in improving care for mothers and children, but also about the partnerships and how important partnerships are to people that here are doing this work and want to make sure that they're trying to develop the best type of support system for the mother and their babies.
Well, first of all, I want to say part of what I think we've been successful as is listening to our everyone that walks in our doors, but also our providers. Again, from the front desk to all the way up to physicians, and so that's very important. So, having said that, I want to say first of all that I am so proud, and it's a privilege to be here this morning with people that have actually crossed over from southeast, northeast to get to this place in Northwest. And so thank you for being here. I understand that there's so many people here that are actual mothers that are receiving services that are probably people that walk through our doors or someone else's doors here in the District of Columbia. And to all the people here that are immigrants from all over the world, I welcome you. This is an extraordinary city that is so recipient to us as immigrants. And so one of the policies that I want to put the policy out here first is to maybe have a convening like this where we're talking to each other, where the Afro-Americans and immigrants and whites and the new communities that are coming into the city talk to each other about all that is in us, makes us who we are and who makes us act in the way that we act, that affects the way that we deliver care and the way that we develop programs. But I think that over the years we have been listening to people. We started 30 years ago for immigrant pregnant women who were not getting care, and here we are 30 years later, and I feel like sometimes we haven't done very much, but the fact is that we have done so much, as you mentioned, just in the numbers, but more important in the partnerships and the programs that we've grown. I think we started with pregnant women, and pregnant women then had their children, and they were like, well, what about our children? Who's going to see our children? And we started actually pregnant women and home visiting, because that's how we got them engaged. And then so on, every single program was the brainchild of a provider or the community themselves, to the point where now we have the health piece. But as an immigrant myself, I knew the social determinants of health very early on. I fled a country and 50 years of stress to come to this country and realize the things that the reason I am who I am is because of the services that we're providing at Mary Center. They're the services of not only just health care, but social services that are really looking at the entire person as a person in the place that they live, all the social needs that you were talking about. But also, why I'm sitting in this chair, and could have been very different, just a flip of a coin, is the education. And so to me, we can't separate healthcare and education. And I'm talking about not just health education, but education of our children. Because that's how we're going to transform and change the next generation. And so we have partnered with an adult education and early childhood program with BRIA. BRIA was part of us, but they were able to become a charter, and now they're independent, getting just as big as we are. But the idea is that, you know, we have education for our children, but we forget about our parents. Once a parent drops out of high school and gets to a certain age, we forget about that. And so I urge our policymakers here in education and healthcare to make sure that we don't forget them, to make sure that we think about trade schools, that we make sure that we think about you know, adults that are going to be their children's first teacher and best teacher, and they are not going to be able to do that if we're not supporting their education needs. So in terms of our partnerships, I'll just say that we have over 50 partnerships. I think my staff will probably say more like 100 partnerships, but 50 that I know are very strong, that help us do the things that you just talked about. Social justice, you know, the justice, juvenile justice, to make sure that everyone gets a fair chance, that no one goes to jail because, you know, they made a minor mistake. That the issues of housing and all of that. But the partners that we have are lawyers, our advocacy and policy forums here in the District of Columbia, like the DC Physical Policy Institute and Children's Law Center, just to mention a few, are just very strong partners of ours. Our foundations, like the Bainham Foundation, that is working on systems with government and with the nonprofit to make sure that the early childhood infrastructure is there and that our next generation does not have to have these outcomes that we have today. So I'll stop there, but thank you.
Thank you. Stacy, you are the former U.S. President of the United Way. You are now the fifth president of the March of Dimes. Big organizations doing a lot of big things, not only locally, but all over the country. Tell us a little bit about the work that the March of Dimes is doing to broaden your prenatal health area, the work that you're doing surrounding moms and babies. Talk about that so people can know exactly what's going on with the March of Dimes.
That's great, thank you. And I neglected to say thank you to Mayor Bowser at the very beginning of this. The incredible leadership that she is showing today and every day on behalf of moms and babies in the District of Columbia is spectacular. And I think we can't thank her enough for her leadership and her team for pulling this together. And I just want to say thank you. This is the first of these kinds of events I've gone to. There have not been many. We hope there'll be more. But I think we need to give Mayor Bowser another round of applause for her great leadership. So the March of Dimes is a leading organization and the national organization in the country focusing on improving the health of moms and babies. We focus primarily in the U.S. We do have activities outside the U.S., but our focus is really on how do we make sure that we can change the direction of health outcomes for moms and for babies. And I think one of the things that we have to be really clear about is the fact that there is talk about misperceptions, and just to underscore something that was said earlier, what we know is that it is really not possible to create a healthy baby in just 9 months. That the health of the baby really starts with the health of the mother. And so when we talk about outcomes for babies, it is absolutely essential that we talk about the health of mothers, the health care provided to those mothers, the health care that they receive and how they receive it, and whether or not we're ensuring that those mothers are as healthy as they can be before they conceive, that they get the right care throughout pregnancy, and even what we're seeing now is that it is just as important to also focus on the health of mothers right after they deliver. So that cycle of mom and baby health is really critical, and we're trying to be very clear about what do we have to do from a systems-wide process in this country, working with many different partners at a federal level, state level, and a local level, to make sure that we fix the many holes that exist in the way care is delivered for moms and babies and women in this country. One of the things that I think is really critical is we are doing an awful lot of research. And one of the things that the March of Dimes has always done, a lot of people know the March of Dimes from our days in polio, and there are very few organizations that you know of that have actually taken on a big health issue and solved it. The March of Dimes did that with polio. It was one of the worst health crises in this country many decades ago. And after having solved that and continuing to work on issues affecting children and now focusing on the issues of especially prematurity, but now all of these issues around maternal mortality, morbidity, prematurity, infant mortality, one of the things that we have come to really stay very focused on is the importance of medical research and making sure that we are doing everything we can to uncover why it is that, especially on premature birth, why it is that babies are being born too soon. The fact of the matter is, and one of our, our chief scientific officer, when I first started the March of Dimes said, Stacy, we could maybe fix babies being born too soon if we understood how babies get delivered in the first place. We understand how babies are conceived, but we actually don't really understand the mechanics and the mechanisms around how babies are delivered. It's still something we're trying to uncover. As long as women have been delivering babies, it's kind of baffling that we actually don't really understand the biological mechanisms of how that works. So one of the things that we're doing is we've got 5 research centers around the country, a new one that just opened in London, to look at a variety of issues that impact women with respect to understanding how it is that babies are born sometimes too sick and too soon. And in this country, we know that about 1 out of every 10 babies is born premature. It's almost 400,000 babies in this country, and those babies often do just fine through their lives, but many of those babies end up having lifelong health challenges. So our greatest purpose right now is how do we make sure that moms and babies are healthy, that moms and babies have the health care that they need, and that we improve those outcomes, and that we do it in every part of this country and everywhere around the world. While we're waiting for those results on medical research, though, we've got to figure out how we identify the right interventions today that can produce better results for moms and babies today. And fortunately, there are some things that we know about what can actually improve the outcomes for moms and babies. One of the things that we've been working on for many years, and we're actually scaling a program right now, is around group prenatal care. And this is a program that has been around for a while. It's an evidence-based program. We know that group prenatal care can reduce the risk of premature birth by over 30% for all women and over 40% for women of color. And this is in addition to prenatal care that a pregnant woman may receive from her healthcare provider. This is group prenatal care, which is really a group of women who come together of the same gestational age and who talk about the issues that are going on in their pregnancy over the course of the pregnancy. And it's interesting that that group approach has the kind of results to improve the outcomes for babies as significant as we see. One of the things that we think is sort of underpinning all of that is going back to an issue that we talked about earlier, and that is that pregnancy is not easy. And often pregnant women can feel very isolated. You can feel as though you're going through these things alone, even though we know lots of women that have been pregnant before us and while we're pregnant, and many more pregnant women to come. But the idea of how much women experience stress just because they're pregnant, and then stress in life that can impact the pregnancy, group prenatal care appears to be a very effective mechanism and intervention that produces real results, especially for women of color and especially for African American women. So we are trying very hard to make sure we can make this program available, and that's just one of the things that we're doing. But as you know, I think the thing we have to focus on is we are at such a point of urgency in this country around the outcomes for moms and babies. We have to move quickly, and we have to scale as expeditiously as we can those interventions that can produce real results today, even though the long-term results in research may come over the next several years and decades.
Thank you for that. That is fantastic, the work that the March of Dimes is doing. Dr. Liu, you're at GW, and before that at the U.S. Department of Health and Human Services. And you have this perspective. We heard about the local perspective and even the national perspective, but you have a perspective surrounding what this infant and maternal health says about a society globally. Tell us a little bit about some of your perspective as it relates to that as we move into our last couple minutes on the panel.
Yeah, so in public health, we can always tell how healthy a community or society is by looking at its infant mortality or maternal mortality statistics. Now, infant mortality is pretty straightforward, right? It's like canaries in the coal mine. Babies are a lot more vulnerable than grown-ups, so whatever's harming the health of a community is going to show up first in infant mortality statistic before it shows up in adult mortality statistic. So we're the richest nation on earth, and yet we have one of the highest infant mortality rates amongst all developed nations. What does that say about the health of our nation? Now, the one thing that I do worry a lot more is that now there's this whole growing science around what's called the fetal origins or developmental origins of health and disease, which basically says that there's a host of chronic diseases like high blood pressure, diabetes, heart disease, and cancers that may actually trace their origins to inside the womb. The idea is that there are these sensitive or critical periods during development during which the function of an organ or system is being programmed. If things don't go right, if something goes wrong with that programming, then that organ or system may not function optimally over a life course and therefore set you up for chronic diseases later on. So my big worry is that the high infant mortality rate not only says something about the health of our community and our society today, but it's also saying something about the health of our next generation for years and years to come. And so I think it's imperative for us to really do something to turn the tide, to move the needle on infant mortality, both here in DC as well as around the nation.
That's good. We have just a couple minutes left, and so I want to give you all a chance in about 30 seconds to start us on our solution run, because we've level set the issue and we'll have solutions throughout the day, but you get to start our solutions. And so we'll start with you, Kelly, and then come down to Dr. Liu.
Great. I have three I'd like to mention.
There you go.
And I'll make them quick. So first, I think it would be great to have a citywide education campaign around early entry into prenatal care, as well as family planning. And I know the DC Family Planning Initiative has been working on that. But as providers, we need some other education that's going out that's very impactful and connects with the people we need to connect with. The second thing that I'm really excited about is I think the new hospital at St. Elizabeth's can be a real game changer. But I'm really looking forward to conversations soon about the prenatal component and how the hospital will work with existing community health centers and primary care providers within Ward 8 in particular, so that we can really make it the game changer that I think it could be. And the third thing I would recommend is the DC Primary Care Association just came out with a policy brief around human-centered design. I really encourage you to take a read of that. There's a lot of great quotes from women and providers, as well as some very strong policy recommendations in there as well.
I would say a few things. One is that I think we do have to examine that there's been a lot talked about in rural areas around what we would refer to as maternal care deserts. And I think we have to recognize that those deserts don't just exist in rural areas, they exist in urban areas too. We have shortages of OBGYNs, we have communities and neighborhoods without access to hospital for delivery, especially if you're a high-risk pregnancy. There is a lot we have to do to make sure that there is not only healthcare that's affordable, but it's also closely accessible for women, and making sure that women understand where those opportunities exist. I think we also have to look at potentially alternative forms of delivering care. So supporting doulas, for example, to make sure that there are more women who understand, doulas in the audience, We're very supportive of women having access to those kinds of services because what we find, especially for African American women, those services tend to be more accessible. Those services and doulas often tend to make it more possible for women to access services in the formal healthcare system and make that easier for them. The other thing I would say is that I do think, and we have amazing partnerships with hospitals and healthcare providers at the March of Dimes, we want to work more closely with the formal healthcare system to deal with the issues of implicit bias, to make sure that healthcare providers really are treating all women and all babies with the care and the concern and the listening that they need. And what we're concerned about is too often that doesn't happen. So there are many things we can do, and I want to echo what Kelly said, but those are some of the ideas that I think we would offer up.
Yeah, Maria.
Oh, I had like 20, but some have been said already.
You
but
see that little flashing light down there?
Definitely will start for sure to make sure that we continue the commitment. Thank you, Mayor, for making sure that we have this high rate of health insurance access. I think that goes without saying, but and then the second one, I think, again, thank you for making this a sanctuary city. I know you're going to be under a lot of constraints to maybe change that, but being a sanctuary city, thank you so much for that. That puts a strain on all of us, not just on immigrants. The cultural bias is, I think, demanding that all of us, both at the hospital level, at the community level, make sure that we take and we own this curriculum of the implicit biases, training, the cultural humility, and also customer service. Because customer service, I tell you, this is many of the studies, many of the surveys have said the reason people don't walk in is because of customer service. I know that there's a lot of controversy about universal home visitation as one little strategy, but I would encourage that if we can destigmatize home visitation, and everybody gets it, that you and I and all of us that have health insurance and the means get it, as well as then it's not just for poor people. I would say also that telemedicine and care coordination, I think, is something that is a strategy that needs to figure out how it gets paid. And I think that there's great strides being made at the DC Healthcare Finance to do this. If we can get it done, the sooner the better. But it deals with the issues of people with behavioral health, deals with the issues of transportation, issues of childcare, those kinds of things. So, and then, again, I just say one more. I think that the mayor has done extraordinary things in education. I would also just say to you, please consider more technical schools for our parents to go from being a child care provider to being a medical assistant to those higher paying jobs. Sometimes it takes that technical schooling to get people there. And there's so many of our clients that are ready to go into the workforce and just need that technical school to get us. And we can work with some of the Trinity College, other UDC to make sure that happens. Thank you.
Dr. Lowe, thank you.
Now, I truly believe that in 21st century America, no woman should ever die from pregnancy and childbirth. So I really like us to work toward eradicating maternal mortality right here in DC and in the United States. And I think we can get halfway there simply by improving the quality and safety of maternity care that we offer across hospitals here in DC. Right? In California, we implemented something called safety bundles in the hospitals across California that led to about a 60% reduction in maternal mortality in 6 years. So if we could get all the hospitals in DC to adopt these safety bundles, which is designed to improve the quality and safety of maternity care,
I became pregnant at age 15,
halfway to
and
zero
I had my son at age 16. I had him on the very first day
Let's give
of
a round of
senior year
applause for our
in high
panelists.
school. And my pregnancy,
We thank you so much for taking the time
it was
to
rough to deal
participate.
with, as far as like the emotions wise and mentally wise. But physically, I had a pretty good pregnancy. But when I found out I was pregnant, I found out at my high school's clinic I attended H.D. Woodson Senior High School. And when I did find out, immediately they got me connected to a social worker. Like, I didn't even get to leave out the health clinic. The social worker came in and said, she started talking to me, and then I just remember one thing she said that stuck with me was that you're going to graduate high school. After that, she connected me with WIC services, and then a prenatal doctor's appointment, and with Unity Healthcare. And then from then on, I made my own choices and decisions about where I wanted to receive my prenatal health care at. I decided to switch over to, well, at the time it was called just Family Health and Birth Center, but now it's called Community of Hope Family Health and Birth Center. And I received my prenatal care there. I did have a natural birth. I had no medications. I had my son at the Family Health and Birthing Center, and I had a water birth. At the time, I had requested for a doula, but the way the birthing center at the time was set up, they had volunteer doulas, so they didn't have a volunteer doula available at that time, so I would just always say that my son's dad was my doula. The advice I would give an expectant mother is to go to your prenatal appointments and create your village. Start creating your village, because it takes a lot of work and support to raise a child.
Well, life before having Denise was pretty busy. Like I said, I have a 7-year-old and a 5-year-old, so I'm constantly on the go, school, homework. She does cheerleading, dance, everything, so it's pretty busy. This one was very nervous. I had 3 C-sections, so I was very nervous the 3rd time, just because of the health risk and all that they tell you before you go in, before surgery. So I was really nervous, but once I laid down on the table and I heard her voice, I kind of just was very relieved. I cried. It was a good experience. Everyone was very different, so I can say that I was more nervous going through the process of having her than any of the other 2. Wow, I did the centering class at the Community of Hope on Conway, and that was like the best experience. I got to meet a lot of moms, I got to network, I had a lot of time to relax and not worry about things. We got to do a lot of arts and crafts. I have a very big cast of my belly from when I carried her, which was one of the things I was very excited about doing, because I did not have the chance to do that with my other 2. So it was great. I also do the parenting class at Conway as well. I like to stay active, because if I don't, then I don't know. Just more support groups, reaching out to communities that they wouldn't necessarily go out to. There's a lot of moms out in my community that if they have the information, they would love to be a part of it. I know I'm one of the moms that if I know about something, I'm gonna be right there just to experience it, because you never know who you can meet or the things that can happen through that. So just more programs for the moms to get together and network, and even for the fathers, because I think sometimes we leave the dads out. There are a lot of hardworking fathers out there. Getting them together and, you know, just letting them know that they have a support system as well, I think is something that is needed.
Please welcome to the stage the moderator for our next panel, Community-Driven Solutions, the Key to Sustainable Progress, Dr. Tanya Royster, Director of the District of Columbia Department of Behavioral Health. And our panelists, Brenda Rhodes Miller, Executive Director, DC Campaign to Prevent Teen Pregnancy, Sarah Barclay Hoffman, Assistant Director, Early Childhood Innovation Network, and Sherry Kraft, CEO and founding executive director, Smart from the Start.
Good morning, everyone. Good morning, everyone. I realize we are the last panel before lunch, but we also are the community-driven solutions panel, which is where the excitement and opportunity happens, right? You heard the introductions of our amazing panelists, so I am not going to spend a lot of time telling you their accolades. They're going to do that in their presentations. But this is just so exciting. Those of you that know me know that I'm all about solutions, and I'm all about engaging communities as a part of those solutions. So welcome, ladies. I'm sure we're all going to learn a lot. I'd like to start with a general question that each of you can take a moment to answer. There's a common belief that communities who experience health disparities lack resources. Do you find that communities you serve lack resources, or that residents need support in navigating the existing resources and systems of care?
Start?
Yes.
I think every community has strengths, and I think taking a strengths-based approach to communities diffuses some of the anxiety that people have when you come from outside and say, I'm here to help you. But I also think that it's important to connect communities to resources about which they may not know, and to have information sharing opportunities.
I could not agree more about the point that our communities have strengths. We are here, of course, to acknowledge that there are disparities, there's work that needs to be done, but that does not mean that we're starting from scratch, from zero. Communities have resilience. They have incredible networks. There are phenomenal organizations that are doing incredible work across all wards in the city, organizations that are indigenous, east of the river, that are providing healthcare services, education services, and connecting folks to the services that they need. So I would add, though, that I think we can do even more in terms of integrating services with the Early Childhood Innovation Network, with healthcare providers. I work at Children's National Health System. We're seeing that families and communities, families with young children, are really gravitating towards being able to have services, particularly mental health services, located and integrated in those spaces that they access every day. Their physical health, primary health care, their places of child care, obstetrics. So I think that's an area that we can further work on.
I agree with both of my fellow panelists. The communities that Smart from the Start has the honor of partnering with have incredible strengths and resiliencies. And I grew up in a housing project very similar to the ones that we embed programs in at Smart from the Start. And we are a resourceful people. We have, for generations, made something out of nothing. We've raised brilliant children. We've held families together. Yes, there definitely is a need for additional resources, but I think what's most important is that we recognize and uplift and celebrate the strengths and resources that communities have, and then build on those strengths and resources by partnering with the experts in the community, the families that live there, the elders, the parents, the grandparents, the dads, the clergy and other folks who are the stakeholders and really are the pillars of that community, because they're the ones who know where the gaps exist. And so instead of creating programs and parachuting them in resources, we need to build on the resources that already exist and partner with those who have the greatest expertise and experience to fill the gaps, so that we can together create environments that are conducive to healthy development.
Great. And Ms. Kraft, you started to talk about Smart from the Start, which is a program you created in Boston, but being a native Washingtonian, you brought it back here. Tell us why, and tell us why the program works.
So there was this ongoing competition growing up. My mom was from Boston. My dad was a native Washingtonian. So I have to say I grew up between both cities, just so I don't get in trouble with anyone. But Smart from the Start is celebrating its 10th anniversary this year. And as a founding executive director and CEO, what I felt was missing in terms of providing communities with tools and support were programs that really were family and community driven in an authentic way. And what I mean by that is that, you know, there are lots of great programs that are doing great work in both cities, but we still have a continuum of generational poverty and school underachievement that continues to perpetuate itself because clearly what we've been doing hasn't been reaching everybody. And so, given an opportunity to create this organization, I brought in all of those I spoke about in the last answer. I brought in families, I brought in teen parents, grandparents, folks in recovery, parents that have been incarcerated, everyone who has amazing expertise, survival skills, strengths and resiliencies. And I asked them to come in and help me create this organization because I feel like if we're going to get something that we've never gotten, we have to do something that we've never done before. And I truly believe that those folks have not felt like they were part of the conversation. And I think that's what's contributed to our early success.
And it has, and we're so excited you came back to your real hometown. Right. Ms. Hoffman, we really introduced this concept of place, and we know that it's increasingly important in terms of successful health outcomes. Can you tell us about the Early Childhood Innovation Network as a local example of a place-based initiative? How does it work, the partners, and the successes that you're seeing already?
Great. Well, again, thank you so much, and thank you, Mayor Bowser, again, for convening this really critical conversation and opportunity to share information today. The Early Childhood Innovation Network, or ECIN as we call it for short, was started in 2016, and while initially a partnership between two institutions, Children's National Health System and MedStar Georgetown University Hospital, ECIN has, with I think both great purpose and intention, quickly grown into a very robust local collaborative where we have community members, families, healthcare providers, early childhood educators, community-based organizations, researchers, and advocates coming together to co-create solutions to further enhance community and family resiliency for our pregnant women, for dads, for our infants and toddlers, and to really build the capacities in adults, those skills and knowledge, so that we can have healthy adults, because we need healthy adults to grow healthy children and improve those health and educational outcomes. And there's three core pillars we're focused on: innovations in care and family support, just as some concrete examples of what that looks like. Integrating mental health care into obstetrics, so when women are going to all those prenatal appointments, they can access emotional well-being supports while they're there. Teaching mindfulness skills to parents when they are visiting or when they're dropping off their children at their early learning provider. One of the mayors this morning talked about education and technical assistance. We're also providing education and technical assistance. An example of this is providing support to pediatricians across the city, across the District of Columbia, so that they can effectively integrate systems of screening and referral and support for maternal mental health, like postpartum depression. And we're also working on policy and advocacy. A recent example, we worked strongly with an incredible coalition and are so thankful that the City Council and Mayor recently signed the Birth to Three for All DC Act, which provides further incredible supports around health and education for women and infants and toddlers. And thinking of, there's a few things that come to mind in terms of some of those key lessons learned, early successes that we're starting to see even as we're just 2.5 years into it. And I've talked some about this co-creation piece, and I've heard that from the panelists, and that's so critical and important to the success of community-based solutions. And I would liken this to considering your your favorite family recipe, one that has been handed down through generations in your family, right? Those are the ones that are you could consider the most successful, the most sustainable, because they've been in your family for a long time. And what does that look like in terms of the time that it takes and the ingredients? And I would venture to guess, as you're thinking about this recipe, though perhaps not too much, since I do know we're bumping up on lunchtime, that it takes a lot of time for that recipe. It's not just the 10-minute quick dinner you put on the table during a busy work week, and that it requires a lot of rich, diverse ingredients, and that each one of those ingredients is absolutely essential and critical to the success of that dish. Well, that is really what we're working on with the co-creation process, bringing together those rich, diverse perspectives from academia, from researchers, but always with family and community at the center, and always listening to that, and that it's through the whole process, not just the idea formation, but the implementation, the evaluation, when we're figuring out if these solutions, what those results are. And this co-creation process is our place-based strategy is an example of how we have done that co-creation process. We heard from some of our core leaders on ESIN, the Health Alliance Network, Total Family Care Coalition, Far Southeast Family Strengthening Collaborative, Parent Watch, that we really should harness the power of peer support. And so we have done that, and together created a model that's just, we're about to be implementing in specific neighborhoods in Ward 8, where neighborhood family champions will be working with families with young children, making sure they have access to the resources, helping to navigate that, building upon an important healthcare component, Children's National Primary Care Clinic, that's implementing an evidence-based model that supports young families with young children. And also leveraging that technology, we'll be deploying a mobile application. And also just want to highlight very quickly, some of the mayors this morning talked about mental health care, and that is so critical as we're here today talking about maternal and infant health. Maternal mental health is absolutely essential. They're some of the most common obstetrical complications.
Absolutely.
And we have treatments that work, and women should not be ashamed. And we have lots of great resources in the city that we can ensure that women are connected to those resources.
Wonderful. So we've talked about place and we've talked about smart from the start, but the district also realizes that in order to improve the health of moms and babies, we have to start before birth. And so under your leadership, Ms. Rhodes Miller, for the DC campaign to prevent teen pregnancy, you have supported a vast number of local organizations. Can you talk about some of the effective strategies that have led to a reduction in the number of unintended teen pregnancies in the District of Columbia?
Well, I know I'm a naysayer, but I think the intentionality of teen pregnancies is sort of beside the point. If you had a daughter who was pregnant in your house, it would be a crisis. If any of us did, it would probably be a crisis. But before I get to the answer, I want to thank Mayor Bowser for giving DC Campaign the shout out this morning. And I really appreciate being invited to participate. I think that one of the most important evidence-based strategies is a community mobilization effort. DC Campaign's policy director, Jay Cooper, used to say that if there were as many births to teen girls west of the park as there are east of the river, CNN, MSNBC, and every news outlet in town would be lined up on Wisconsin and Mass Avenue. And they would be interviewing everybody about the crisis. And so if we want to look at where teens live, what their parents do for a living, how much money they make, where they go to school, whether they feel safe, that shouldn't determine whether or not they have the opportunity to grow up and have a childhood and get an education before they become parents themselves. So what the community mobilization model does is it asks everybody who has anything to do in the city to play that role with the in mind of helping to prevent teen pregnancy. So if you have jobs, hire teens. If you want to volunteer to be a mentor, mentor teens. Go to your neighborhood school, help out there. But also organizations like Mary Center and Community of Hope all have a teen-focused program, and they make teens feel welcome. Because, you know, they're going to grow up and they're going to vote and they're going to take care of us when we're old and decrepit. So you really want to give teens the best opportunity for success possible. And your zip code shouldn't determine whether or not you have a baby when you're a teenager, or whether or not you have access to the most effective contraceptive methods. And so what we encourage all of the partner organizations with whom we work is to look at this as a community-wide situation where we are all engaged in providing adolescents with the motivation they need to avoid pregnancy in the first place. That means they need relationships with trustworthy adults. They need access to health care that's welcoming and respectful. They need a sense of belonging, and if we can't figure out how to give it to them, gangs sure can. They need a plan for their lives. They need school success from an early age, and all of those factors help prevent teen pregnancy. And in community mobilization efforts, everyone can take one of those things and work on it. And so with the many organizations that you referenced, what we've seen is that when you talk about this and when you say this is a crisis, and yes, the numbers have gone down. Since DC campaign started, they've gone down like 79%, thanks to the support of Mayor Bowser and many organizations in this room. But still, in the capital of the greatest nation in the history of the world, having more than 500 teenage girls give birth every year is still a serious issue, and all of us have a role to play in solving it.
We absolutely do. So as we think about those solutions, and all of our panelists deserve a round of applause, we think about those solutions and really some really effective models that you each have talked about and networks of community providers that you connected to. How do you help those social service providers or people in the community who want to help but don't know how to connect to the communities or feel disconnected? Can we start with you, Ms. Croft, as we work our way, Ms. Craft, I'm sorry, as we work our way through the last few minutes?
So I think what SMART does that's been most effective is that we are place-based. We literally embed ourselves in communities. So if you come to our community in Southeast in Woodland Terrace, you will find a SMART house. In that house, families find a one-stop shop for everything they possibly need in order to support their families. And if it is not in there, we will bring it there. For instance, we have a Focusing on Fatherhood program where we have engaged and supported young fathers, primarily court involved, in social services, civics, employment and education opportunities, mental and behavioral health services. We just graduated a class of court-involved fathers in the spring. There were 19 enrolled, 18 graduated. It was a 14-week course. 5 days a week they had to show up. It was not a paid course, but if you build it, they will come, and if it's embedded in their community and you spend time building relationships, then you are able to increase outcomes. Out of those 18 graduates, 15 are working and 2 of them are in apprenticeships. So thank you again to the city, because a lot of those graduates, although they were court involved, are working for the city in the housing and DCHA and other places. So we know that it can be done. There are mental and behavioral health services there. We have a licensed clinical social worker, as well as Dr. Diane Kern, who is our clinician, who is embedded in that housing development. She is there meeting with families and talking with families and doing empowerment and wellness groups. We have early childhood education. We have prenatal classes in the community, in the housing development, where families can throw a rock and hit us. We have prenatal classes, we have baby basics classes, we teach infant massage, we have play to learn education groups, we do child development assessments and screenings, our staff is EI certified, so we have an array of programs and services there. We have a computer lab there. We help families with an array of crisis intervention services, family stabilization services, and we have a program that we call Address the Stress. And Address the Stress is a program that helps to minimize the stigma around mental and behavioral health and really help folks to improve their own self-esteem so that they can set goals for their self-sufficiency. So I would say to other social service providers that you need to come into the community. It's wonderful to have a great program that does wonderful things, but if it's on the other side of the city, we're not going to impact the families that need you the most. Come into the community. SMART is happy to anchor with you, work with you in our community if you'd like to bring resources.
Thank you, Ms. Kraft. Ms. Hoffman, 30 seconds. 30 seconds on suggestions to other providers about how to connect to the community.
Adding on to that, I would say also thinking about how we can engage in terms of our employment, hiring our community members. So for example, with our place-based initiative and the neighborhood family champions model, those folks are not only working but living. They are from the communities they're serving in Ward 8, and they know the resources, they know the families. So how can we engage in that? And how can we also, as providers and institutions, really also look inwardly and think really seriously and critically about equity. I really believe so strongly that to achieve the outcomes we need to get to in terms of improved maternal and infant health, we have to also look at those institutional and systemic barriers, and what does that look like in terms of hiring practices, career development, so we truly sustainably get to where we need to be.
Thank you. And Ms. Rhodes Miller, 30 seconds.
Oh dear. Okay. So the first thing is, if you have a door, open it and make people feel welcome to come in. Don't focus on what they're not doing, can't do, should do, need to do. Make them feel welcome. And when you get people to cross your threshold that first time and they have a good experience, they're going to tell their friends. By the same token, if they have a bad experience, they're going to tell everybody. So if you want to connect with the community, be a place where the community can come and be made to feel as good as anybody else would if they came to you.
Wonderful. So let me add my thanks to Mayor Bowser and this entire panel for having wonderful creative solutions. It's wonderful to be in a city, wouldn't you agree, where the leadership believes that everyone is valued and everyone is valuable and that we can make everyone be a thriving member of this community. So thank you all so much.